Have you ever heard of rat lungworm disease? It might sound like something out of a science fiction movie, but it's a very real and serious infection, and cases are rising in eastern Australia. This disease is caused by a parasite called Angiostromalus cantonensis. It lives in rats, but it spreads through their droppings to snails and slugs. People and pets can then become infected by accidentally eating one of these creatures, or even just by eating unwashed vegetables that have slime from them. So why is this disease making headlines now? A recent study by the University of Sydney found a sharp increase in cases among dogs in Sydney and Brisbane since 2019. The peak came in 2022, after unusually wet La Nina weather. This has experts concerned that human infections may also rise. Yes, humans can catch this parasite. It usually happens in one of three ways: eating raw or undercooked snails or slugs, eating unwashed leafy greens, or even just handling infected snails in the garden and accidentally transferring larvae to the mouth. Once inside the body, the parasite moves to the brain. That's where the trouble starts. Symptoms usually appear within 1 to 3 weeks. These can include headaches, neck stiffness, tingling in the skin, fever, nausea, and vomiting. In serious cases, it can lead to a dangerous condition called eosinophilic meningitis, swelling of the brain and spinal cord. Sadly, this isn't just theory. You may remember the story of Sam Ballard, a young Sydney man who ate a slug on a dare in 2010. He developed severe brain damage and passed away years later. His case brought national attention to how serious this infection can be. Dogs are also at risk. Vets in Sydney and Brisbane have reported dozens of cases. Just like in humans, the parasite can travel to a dog's brain and cause serious neurological problems, even death. So how do you know if you or your pet has it? Doctors usually look for high levels of a type of white blood cell called eosinophils in the blood or spinal fluid. They'll also ask if there's been any contact with slugs, snails, or raw veggies. There's no specific cure, but many people recover on their own. In more serious cases, hospital treatment may be needed. If you know you've eaten a snail or slug, your doctor might give you medicine like albendazole to stop the parasite early. Importantly, rat lungworm disease isn't contagious. You can't catch it from your dog or from another person. You can only get it by ingesting the parasite directly. So who should be most careful? Children playing outside, gardeners, anyone eating raw greens without washing them, and travelers to areas like Southeast Asia or the Pacific Islands where the disease is more common. How do you stay safe? Wash all your fruit and vegetables. Wear gloves when gardening. Keep an eye on kids outdoors. Control rats, snails, and slugs around your home. And always wash your hands after being outside. There's no vaccine, so prevention is your best protection. If you think you've been exposed and start to feel unwell, don't wait. Talk to your doctor right away. Rat lungworm disease might be rare, but with more cases appearing in our pets, it's a reminder to stay alert, especially during wet seasons. Sometimes, a simple habit like rinsing your lettuce can save you from a very unpleasant infection.